big lips, big boobs, baseline, BBL, fad, or beautiful. These are some of the things that we're gonna talk about in this video. We're gonna talk about fads, things that come and go. We're gonna talk about things that are beautiful, have been beautiful for all time, and the evolution of beauty and how our ideas of what is aesthetically pleasing over time has changed. I'll tell you my own personal perspectives and how it's even changed during my timeline as a surgeon. Hi, I'm Dr. Athre. I'm a double board certified facial plastic surgeon here in Houston, Texas. So what is beauty? Okay, we all know it when we see it. We know that something is beautiful. We use this term, but do we really understand what is beauty? We can define it as something that's maybe aesthetically pleasing. That's a good way to say it, but there's even more to this. So one of my other videos here on YouTube talks about the science of beauty, and I'm going to kind of reuse certain portions of that video. So they did a study on babies in the newborn nursery. And what they did with these babies in the newborn nursery is they started showing them pictures. One side they showed them pictures of fashion models and things or people that we would universally say, this is beautiful. And then on the other hand, they showed photos of either patients or people that had disproportionate faces, something was asymmetrical, or pictures of what we would say like a Halloween witch, things that are not attractive. And what they found is that the babies, when they were shown people that were beautiful, heart rates came down. They were calmer, okay? And yet at the same note, the babies, when they were shown these ugly faces, their heart rates went up. They were more anxious. They started crying. They were agitated. So even newborn babies understand this idea of beauty. And we can break it down scientifically and look at symmetry and all these different things. And there are certain standards that basically withstand the test of time. And there are fads. Okay, so there's these two hands here and here. Let's start talking about the fads, for example. Even in my practice, okay, towards the beginning of my practice, let's take rhinoplasty, for example. The idea of beauty was this ultra sculpted nose. So the women would come in and say, hey, listen, I don't like the little bump. Can you give me a more feminine nose? But I want it really kind of scoopy and curvy. That was the idea of beauty. And if you take a look in the 1980s and you look at fashion models and look at fashion magazines, many women had this ultra scoopy nose. Very tiny tip, very small nose. Now, as we have progressed, and if you take a look at any fashion magazine today, or you look at a Cosmo, or you look at the models on TV, natural is in. These women have a nose that may be still feminine, but it's not ultra scoopy. It's relatively straighter. The features of these models are a lot more natural looking. So we have this idea of fads and how this beauty is kind of an evolving type of process. It's not static. Even, for example, lips, okay? The idea of having full lips is not new, okay? Women for over 3,000 years have been applying crushed berries and powders and all sorts of stuff to their lips to give them fuller, redder lips. It's a sign of health. However, in recent times, that trend has been pushed a little bit, and now you have patients with really overly fulled lips, which somewhat look a little unnatural. So there are these trends and fads, but they're based on this idea of universal beauty. However, as that beauty goes over time, it kind of goes up and down. So what do I see in terms of what the current trends are, the current fads are, and what is my practice philosophy? Or what do I think that you should look out for? So when we look at this, I think that there has been an increased movement toward that which is more natural, especially in the facial rejuvenation world. So when we look at facial rejuvenation, we really see that patients are asking for something that's more natural with respect to every aspect of their rejuvenation journey. When patients come in for Botox, they ask for, hey, I don't want to be frozen all the way. I want to have a little bit of movement so I can still have some facial expressions. When patients are coming in for eyelid surgery, they're saying, hey, don't take out all the fat on my eyelids. Leave a little bit. I want a little bit of volume. For facelift surgery, patients are saying, hey, I don't want just a facelift that makes me look over-pulled or overstretched. I want to look just like myself, except a few years younger. So all of these are quotations that I'm pulling from the patients that I've seen. And these patients are telling you what they're asking for, a result that's more natural. They're not asking to change who they are. They're only asking to change what they look like based on time. Take them back to an earlier spot and just give them the best version of themselves. So I think that in the facial rejuvenation world, there's definitely a trend towards a more natural look. I think that this trend is also can be pushed in other parts of plastic surgery as well. I have several colleagues of mine who do exclusively breast surgery, and they are noticing an increasing trend towards women that are saying, I just want some of the volume replaced in my breast after breastfeeding and all these things. I am not looking to have really crazy, extremely large breasts. So therefore, I think this trend in overall plastic surgery is moving towards a more natural look. Now, I'm sure someone is going to give me here in the comments, what do you think about the BBL, doc? Well, I can't say that there is an absolute in everything, and I think that the BBL is a little bit of a fad, and I will talk about that towards the end of this video. Now, when we look at what my practice philosophy is, and I'm going to tie this into the BBL thing that I just discussed, I really believe that we should aim to look at things that have withstood the test of time. So for example, if I give a patient a very scooped out nose today just because it's a fad, that may not be in 5 years from now or 10 years from now. On the other hand, if I give them a very aesthetically pleasing but natural looking nose, that is going to be in for all time. And I like to use a little metaphor about this so that it kind of gives people a little bit of perspective on this. So if you take a look at houses or houses in a neighborhood, house colors, the outside paint colors, there's a lot of fads. You know, at one point a few years ago, it was this white fad where almost all the houses were painted white. And then after that, we got this dark black gray combo fad where a lot of houses had this gray black combination. Yet there's certain things, like for example, those Greek houses with the white paint and the blue trim, that fad has been there for 3,000 years. It's not a fad. It has been aesthetically pleasing over that entirety of time. Even now, when you go to a place like Mykonos, you go, wow, that's a pretty house. So this is what we should aim for. This is my practice philosophy in terms of kind of separating out the fad, the trend, and picking that line of aesthetically pleasing, which has withstood the tests of time. Now, I will agree that there are patient individual variation. So for example, if a patient comes to me and says, hey, I really think this is beautiful and this is what I want, I will have a discussion with the patient going, hey, listen, this is my aesthetic. This is what I think this might be a trend. This is what I feel is beautiful, but I'm willing to listen and go, what do you tell me? What do you think? And if I feel that you're within that realm of normal in terms of what you're asking for and expecting, I'm willing to give it to you, because I do think at the same note, this idea of beauty is also very personal, and it's something that all of us have different opinions about. So let's go back and talk about that BBL for just a second. There is a baseline value of beauty where curvy women are beautiful. So I am reminded of a study that was done actually at my alma mater, University of Texas. Have to bring in UT somehow into the conversation, okay? And they did one of the largest ever studies, and they pulled in thousands upon thousands of young men. And what they did is they showed them pictures of women, and they had to rank the pictures. Don't quote me on the exact numbers and all this kinds of stuff. I'll give you the basic gestalt. And they found some very universal findings that were cross-cultural, cross-ethnic, ... All men preferred women with a hip to waist ratio of 1.3 or 1.4. And that number correlates, I'm synopsizing the study, that number correlates to a woman who will have the least complications during pregnancy and childbirth. So there is an evolutionary or a very scientific basis to how we define beauty, and that definition of beauty is that we do like a little bit more curvy. It's universal. However, that baseline beauty may have been pushed a little bit above that bar in the new BBL trend. I don't do BBLs, but in case someone wanted to comment on that, I do think that some of these extreme BBLs may be just a bit of a fad and may not be in a few years. So how does this relate to you in your facial rejuvenation journey or your rhinoplasty journey or the such? So as you investigate these procedures or what you want, one of the questions I ask you to ask yourself is, what do I find beautiful? So one of the things that I ask a patient in consultation is, if you had a magic wand, what would you do? And the primary reason I do this is I want to find out what you find beautiful. So when you bring this information in for a consultation, you bring this information into research, one of the things I think you should probably think about is what I'm asking for universally beautiful? Is what I'm asking for a fad? Okay, is this something that's going to withstand the test of time? These are some of the things that will be discussed during your consultation with me as well. I think that these are very important because when I do surgery on you, surgery is not a temporary, it's a permanent. And I want to make sure that you're not only happy with it today, tomorrow, but 20 years from now and 40 years from now. So I prefer the idea of that baseline beauty as opposed to a fad or a trend. I really hope you found this video useful. I hope you found this video interesting. I know that a lot of our videos are very procedure-centric, and this is just a little bit off the beaten path, kind of giving some other points in this whole plastic surgery realm. If you have questions about the video, comments, things you want to know more about, please put them here in the comments section. If you like this content, you want more of it, you want to be notified when new content comes on our channel, please hit the subscribe button. I appreciate it greatly. Thank you so much for watching. I'm Dr. Athre, ATHRÉ Facial Plastics, Houston, Texas.